Robust. Dynamic. Developing clinical leaders. I'm the coordinator of the postgraduate courses in intensive care and emergency nursing. Critical care environments can be really scary for patients and families, and one of the terrific things that nurses do is to make sense of that environment for patients and families. The great thing about emergency nursing is that there are terrific opportunities for advanced practice roles. Emergency nurses are working in highly complex environments. They are often working under pressure. They're having to make really sophisticated clinical judgments, very often in short time frames. An intensive care nurse is usually spending their whole shift with one patient. They get to know that patient's issues intimately, and because of that, they have the opportunity to be an advocate for that person. Our programs, both in emergency nursing and in intensive care nursing, begin with a graduate certificate program. These graduate certificates are terrific in giving nurses a background in the nuts and bolts of intensive care nursing or of emergency nursing, those specific clinical skills that make them confident practitioners in those specialist areas. Once people finish the graduate certificate, they can go on to complete at either graduate diploma or master's level. Of course, it's also possible for our students to enrol directly into a master's program. For students who become passionate about research, and sometimes people don't realise that they could be passionate about research until they're introduced to some of our programs, there is a research pathway. You can take some extra research units, and this sets you up beautifully to go down a PhD pathway. One of the great things about Sydney Nursing School's critical care programs is that we do offer a substantial face-to-face learning experience. It's important to have that face-to-face time, because at this level it's not just about having access to academics, it's actually about having access to your peers. And I think one of the best learning experiences is sitting in a room full of interesting and motivated nurses who learn from each other. One of the things that makes our program really unique is our understanding of the importance of giving people a professional vision and giving them the personal tools that they need to see themselves in the position that they want to be in, to see themselves as a confident and autonomous practitioner, to see themselves as someone who is innovative in care, someone who can build a business case for an interesting clinical innovation. It's teaching nurses to have the confidence in the evidence base behind their care. We teach nurses to question practices that they may have always taken for granted. We introduce these nurses to ways of reviewing their practice so that what they're doing is always evidence-based, is always founded in the most recent understandings about best patient care. We spend a lot of time looking at people's communication skills. So not just how to speak to patients and families, I think people are often pretty good at that. How to negotiate with senior medical clinicians, how to put forward your particular idea of what should be happening with a patient. I love teaching. I think what I love is helping people to find their passion for patient care. I love the way that you can help people have those light bulb moments where suddenly something that seems so dense and complex makes a lot of sense to them. The other thing I love about teaching, and particularly about postgraduate teaching, is helping these people who are already great nurses to actually find a pathway to clinical leadership, to help them find what it is in themselves that will make them the people who make a difference in their institutions, who can be creative in the way that they develop care.